Today we will be demonstrating head, eyes, ears, nose, and throat.
Hello, my name is Charla, and I'm going to do an assessment on your head, eyes, ears, nose, and throat. Can I have your name and your date of birth?
Katie Brandt, 1/1/2000.
All right, Katie, let me just verify that with your patient, or your name band. Great. All right, the first thing I'm going to do is I'm going to inspect your head just for the shape, the symmetry, and make sure that it's in alignment with your shoulders and your body. And then I'm going to go ahead and take a look, and I'm just going to inspect the scalp for any kind of lesions or flakes or any kind of inconsistencies with the texture of your scalp. And I'm also going to look at your facial features, make sure that your eyes are symmetrical. When you smile, go ahead and smile. Make sure that there's no facial drooping, which could indicate a stroke or any kind of neurological deficit. And then I'm going to go ahead and palpate the skull to find out if there are any abnormal lumps or bumps or any kind of lesions, and to make sure that it's intact. Is there any tenderness when I palpate here?
No.
Okay, good. All right, now I'm gonna palpate the bony features of her face. And so we have the forehead. Any tenderness?
No.
All right, and then the jaw, we have the temporal mandibular joint, TMJ. So I'm gonna have you open your mouth and close it. Do you have any clicking, any popping, tenderness?
No.
Okay, open your mouth and just go from side to side. Excellent. Any tenderness?
No.
Okay, good. All right, the next thing I'm going to do is I'm going to palpate the temporal pulses, and I'm just going to make sure that they're palpating. And is there any tenderness here?
No.
Okay, good. All right, the next thing I'm going to have you do is I'm going to have you do an eye exam.
Okay.
So I'm going to test your far vision with a Snellen chart. So I'm going to have you stand up, and I'm going to have you face over here. The first thing I'm going to have you do is cover your left eye and read the lowest line that you can.
LEFODPCT.
All right, she read line 9, which is a 20/15, meaning she can read at 20 feet what people with normal vision can read at 15. So she has really good vision. All right, go ahead and cover up your left eye and read with your right.
LEFODPCT.
Excellent. We have 20/15 as well. Now, Katie, go ahead and use both eyes and read the lowest line that you can.
LEFODPCT.
All right, we're consistent with 20/15. And Katie, are you wearing any corrective lenses?
No.
All right, go ahead and have a seat for me. Now I'm going to test your acuity for your near vision. And we have two options. We have a Jaeger, which is reading words, and then we have a Rosenbaum method, which is using numbers. And do you have a preference?
The words.
All right. So I'm going to have you hold this out at just an arm's length of what you would normally read a book, and then read the lowest one that you can.
His counsels, it would be easy to secure every concession which the safety or the dignity of home might require.
Okay, great. So we're at a number 5 or 1 meter. All right, Katie, now I'm going to check your peripheral vision, also known as a confrontation test. So I'm going to have you stand up again. We're going to face each other. And will you cover up your left eye? All right, I'm going to cover up my left eye using my left hand. And then I'm going to have 2 fingers moving, and I want you to look at my nose and tell me when you see 2 fingers coming in from the
Now.
outside. Okay, I see it at the same time. I'm going to do this 3 different
Now.
directions.
Now.
Good. Let's go ahead and change our eyes. Okay, we're gonna.
Now. Now. Now.
Good. All right, thank you. Have a seat. Now I'm gonna look at the conjunctiva of the eyes, which is the pink part in the lower part of your eye. So if you can pull down your eyelid, yep. And what I'm looking for is to make sure that it's a light pink, that it's kind of glistening, that there's no discharge or drainage, and no lesions. We also want to make sure that the eyelids are equal, that they are not droopy, that they are symmetrical, and making sure that her eyebrows are the same, as well as her eyelashes and eyelids. Okay, now I'm going to check the corneal light reflex, and this is done by taking a pen light and I'm about 12 to 15 inches away from her, and I'm going to shine it directly at her nose. And when I shine the light in there, I want to see light reflexes on both corneas at the same time, and I do that. All right, the next one is we're going to look at the sclera, which is the white part of the eye, and we're looking for any kind of color changes or any kind of surface characteristics. Sometimes you might see yellowing in the sclera if there's liver disease or any kind of hepatic issues. And then people might also have some kind of bloodshot eyes, and it may be normal for them, but abnormal would be like a subconjunctival hemorrhage, which would mean that the white part of our eye is bright red blood looking. And so your eyes look great, your sclera looks great. Now I'm going to take a look at the cornea for transparency. And the cornea is going to be the lens that covers the eye, and I just want to take a look to see if it's smooth in transparency. I'm kind of, yep, look, good. So there's no surface characteristics, there's no cloudiness, and it's translucent. And then the iris is the color part of your eye, and I see that you have beautiful green eyes, and that is round. There's no deviates or deviates or any kind of issues with the roundness. And then pupils, I want to make sure that these are equal, rounded, reactive to light, and accommodate, and it's also known as perla. So I'm going to shine a light. Usually we have this in a dimly lit room, so it helps the pupils stand out a little better. So I'm going to just shine this light in here, and I'm looking to see that the pupils will constrict, and when I'm shining the light in the left eye, I can also see that it constricts in the right eye as well. That's what it's called, the consensual reaction. So I'm going to do that on both sides. Good. All right, and then accommodation comes in when I have you look at this pen light and just follow it all the way towards your nose. And what I'm watching for is to make sure that both eyes are going inward at the same time. All right, now I'm going to have her test the 6 cardinal fields of gaze. And this one is, I'm going to have you focus on this pen.
Okay.
And your head needs to stay in alignment, but I want your eyes to follow the movement. And I'm going to go 3 different directions on each side. So if you think I'm looking at the different extraocular motion movements, and I'm doing this in the shape of a cat whisker, not the sign of the cross. Okay? So we do this. Good job. We're looking for making sure that the eye doesn't move or nystagmus. Yeah, that's the word. All right, now I'm going to do the cover and uncover test. All right, we're going to just close this, and I'm going to remove it, and I want to make sure that the eyes do not move any different, that they basically stay the same, both sides. Yep, they do. Now I'm going to go ahead and palpate the eyebrows and the periorbital area. Also check for the lacrimal duct to see if there's any plug. Is there any tenderness at all?
No.
Okay, good. All right. Next, I'm going to go ahead and test for, we just talked about the corneal reflex, and this is something that would be tested in someone that was unconscious. And this is where you would test their reaction or reflex if you touch a cotton to their cornea. Since she's alert and I don't need to test hers, so you don't need to do that during your skill check either. All right, next I'm going to have you, in each bed bay we have an ophthalmoscope, sorry guys. And this is obviously an otoscope, but in the bays we have ophthalmoscope. You turn on the light and you're going to be checking the pupils for a red reflex. And so you turn it on and you point it here, and you want to make sure that you see a red reflex, red or orange reflex in the pupil. And you do that on both sides. And you turn it off. All right, now I'm going to assess your hearing. All right, I can tell through normal conversation that she's able to answer my questions and she's following commands. She's not going, huh, what, huh, every single time I ask her a question. So based on normal conversation, I can tell that her hearing is within normal limits. So now I'm going to inspect her ears. I'm going to look at the external alignment of them to make sure that they're in good alignment with the rest of her body. And typically you want to see that they're in equal with the external canthus of the eye. So you want to make sure that the earlobes or ear here, you know what I mean? The ear helix is about the same distance there. All right, and I'm also going to look at the external meatus here and the external auditory canal. I'm checking for any kind of foreign bodies or any kind of drainage that might be there, lesions. Do you have any tenderness here when I palpate your ear?
No.
Okay. And then I'm going to take my otoscope and I'm going to go ahead and pull back the ear pinna. Pull it up and out. And then I'm going to take a look inside. And I am looking for just making sure that there's no foreign bodies. I'm also looking to see I note that there's some cerumen in there, and there's also the tympanic membrane that I can visualize that, and that it's translucent and pearly gray. And then also, I'm going to do that on both sides. I don't want to like show you my backside, so during your checkoff, you're going to do both sides. All right. You also want to make sure that you palpate the mastoid process here, and if there's any tenderness. I'm looking for any kind of abnormalities. Some people that have, they might have like cauliflower ear or something if they've been boxing or have some abnormalities there. But no swelling and no issues there. So I'm going to test the function of your hearing, and the first thing I'm going to do is a hearing test. Whisper test. I'm going to have you close your eyes, and I'm going to get behind you, and I'm going to say a word. Okay.
Yellow.
Yes.
Blue.
That's right. All right. And then I'm also going to do a finger rub test. So while your eyes are closed and I'm behind her, I'm just going to kind of...
I can hear it. Yep.
Excellent. Okay. And then we have the Weber test is going to test to make sure that you can feel these vibrations on both sides of your head at the same time.
Okay.
So I'm going to tap this and make sure that you do not hold on to the top part because it will stop the vibrations. You want to only hold on to the stem here. You're going to place it on the top of her head. And do you feel vibrations on both sides?
Yes.
Okay, good. So that's the Weber test. And then the Renee test is where we're going to assess for air conduction versus bone conduction. And so I'm going to initiate this tuning fork, and I'm going to put it on your mastoid bone, and then you're going to tell me when you stop feeling the vibration, and I'm going to move it to the outside of your ear, and you tell me when you stop hearing it.
Okay.
Okay, again, you don't want to touch the main part of it, you want to touch only the bottom. And you want to count how long she hears it. Feels it, sorry.
Okay.
All right, and then we're going to move it here to how long she hears it. We should have a 2 to 1.
Okay.
All right, and we did. We had 6 and 12. So that's the hearing. Now I'm going to take a look at your nose, and I see that it's symmetrical, that it's not deviated. We don't have any, the nostrils are open, and I don't see anything that's strange. So I'm going to go ahead and palpate. Is there any tenderness to your nose?
No.
Okay, good. And have you had any issues with smelling things?
No.
All right, so go ahead and plug one nostril and go breathe in. Any issue?
Nope.
Go ahead and do the other.
Nope.
Excellent. All right, great. Now I'm going to take a look at the internal surface of the nose, and I'm just going to be inspecting for any kind of foreign objects or any character issues, any Oh my gosh. Erythemus discharge drainage that's abnormal. We just want to note that sometimes people with allergies will have a little bit of inflammation in there and it'll be a little bit red. But no foreign bodies, you're looking good there. And now I'm going to assess or palpate the frontal and the maxillary sinuses. So I'm just going to palpate here on the frontal. Any pain?
No.
What about here on the maxillary sinus?
No.
Excellent. Okay. Now I'm going to look at your lips, and I'm looking for color, which she has nice pink lips, and they're symmetrical, and they're not chapped. They're moist, and the texture looks a little bit rough, but still no open areas or lesions. Now, can you show me your teeth? Good. They're nice in alignment. They're white, and your gums are pink. Good. All right. And then also I want to check your tongue. So open your mouth, stick out your tongue, and we see that it is not deviated. It comes out. It's able to move, and also looking at the surface of it, making sure that there's no abnormal characteristics, no white patchy areas. And then I'm going to go ahead and look inside your mouth, and I'm going to check out the soft palate and the hard palate. So open real big, tip your head up a little bit, and there we go. We see that the uvula is there, that I can see the posterior pharynx and tonsils. They're red, they're not enlarged, there's no white patches. I can also assess the hard and the soft palate, and making sure that there's no issues there. Do you have any tenderness?
Nope.
Okay. All right. So you could also put on gloves, not in the skill, but we would generally palpate the teeth and make sure that there's nothing loose. All right, the neck, we're going to go ahead and check the position of the neck in alignment with their body. And I'm going to make sure that I don't see any abnormal lumps or bumps or protrusions from her neck. And I see that I'm going to test the range of motion. So Katie, can you go ahead and look up and look down and look from your side to side and then ear to shoulder on both sides? Do you have any pain or discomfort with any of those movements?
Nope.
Was any movement hard to do?
No.
You kind of want to see a smooth transition from all those motions. Now I'm going to test the strength of her sternocleidomastoid muscle, and I'm going to have you turn your face towards my hand, and I'm testing to make sure that her neck muscle is strong. Good. And then I'm also going to test her trapezius muscle here by having her raise her shoulder. Oh, very good. Very strong. All right. Now I'm going to also check the midline of your neck to make sure that the trachea is not deviated. And I'm also going to gently palpate the thyroid. So you just kind of go in here. Can you go ahead and swallow for me? Good. That's all great. No nodules or anything. And then I'm going to go ahead and I'm going to palpate lymph nodes. And I don't want to feel them really, but if they're large, abnormally big, if they are tender, those are all signs that those are abnormal. So we have several locations. We have the preauricular. I'll do it on this side so they can see. Preauricular is going to be right in here, in front of that ear. Postauricular is right back here. And then I have submental. Submandibular is going to be underneath the jaw. Occipital is back here, the base of the skull. And then I have the anterior and posterior cervical chain. So I'm going to have you turn to the right, and you have them turn, and then you're going to do the posterior cervical chain, and then the anterior cervical chain right here. All right. And I think that concludes our head, eyes, ears, nose, and throat assessment. Thank you.